Hi, my name is Ammar Ahmed, and I am a dermatologist. I chose to go into healthcare for a couple reasons. When I was in college, I was actually deciding whether to go into medicine or to become a teacher. And I was thinking later on about why did it come down between those two things. And there's a lot of similarities. In my current role, there is a lot of teaching in both those specialties. It's not a desk job. You're with people 100% of the time. Choosing dermatology came a little bit later on when I was a third-year medical student. We had finished some of our core electives, the internal medicine and pediatrics that all medical students do. And then we had time for electives, and so I got to take a dermatology elective, and it was just fun. It was so much fun. It combines so many different things that I like. I think listening and trust are paramount to a successful doctor-patient relationship. At the end of the day, if it's the patient comes in and says, I have X problem, and then everything else is just a doctor spouting off an answer. Well, we need to do A test and B test and C test and get you on this medication. Sometimes the real problem can get lost there. At the end of the day, you know, when I go into a room, my #1 goal is to sit down. We have extra chairs in our room, and I sit down and I listen to what the patient has to say. A lot of it is family. You know, my wife and I were blessed with a 2-year-old daughter who's the joy of my life, and so we spend a lot of time outdoors. We go to parks.